Welcome back. There is a earth-shattering executive order that just got passed in terms of medication costs. We're going to look at what it does, why it's so important, why it's taken so long for us to finally get this, but more importantly, how much you can actually save on some of the biggest medications out there, from Ozempic to Humira to everything in between. We're talking real money in your pocket. Let's dive into it right now. Before we jump into this new executive order and how much you could potentially expect to save with it, we need to get a lay of the land. We need to talk about why medication costs are so high right now. And this part's probably going to make you a little upset. I know I get angry about it, but basically, we have been subsidizing the costs across the world. So for the exact same medication and from the exact same factory, that medication will be 3 times as more expensive in California or the United States as it is in Germany, in Canada, in Japan, basically the developed world. We're paying 3 times as much. The question is why, if it's the same medication? Well, those countries have said, look, we're not going to pay for that. This is the amount we're going to pay. And then the manufacturers took that and cost shifted it onto us. So we are paying 3 times the amount, basically to subsidize and keep costs lower in other countries. That's just the way it is. Regardless of political stances, left, right, that's what has been happening. And so those costs are much higher. And in fact, 75% of the pharmaceutical companies' profits come from the United States, and we make up 5% of the world's population. The question is, why hasn't our government, left or right, over decades now, done the same thing and put pressure on it? You can reply in the comments as to why you think that's happened. We're not going to go there, but they didn't until now. And that's why this is such a big deal. Let's look at the executive order, the 2 main components that are really important to us and to you, and then we're going to look at actual examples in terms of what you can expect to save going forward. And we're talking Ozempic, we're talking Xarelto, we're talking big medications that are very popular and very expensive. First, let's talk a little bit about the executive order itself. Let's now look at the executive order. We're going to break this into 2 sections that are both incredibly important. One revolves around what's called most favored nation pricing, and the other is direct-to-consumer purchasing. Let's talk about the first one because that's the big one. Most favored nation pricing basically says if a certain drug is available in other countries at a much lower price, then people in the United States should also be able to buy it at that price. In fact, that we should be able to buy it at the lowest price that's available in these other countries. So if there's a drug that we're now paying $500 for, and it's $100 in Japan or Canada, well, there are mechanisms in the executive order to force that price down to $100 for us in the United States. This is a huge deal. Because if you look at a drug, a popular one like Ozempic, that might be $1,300 in the United States, it might be $300 in Canada, and even $100 over in England. Well, with the new law, it says you can't charge the United States more than the lowest price, that $100, for example. This is gigantic because medication costs are single-handedly driving the cost of healthcare, driving the insolvency of Medicare, Medi-Cal, Medicaid. So by forcing these costs down, it's going to have a huge reduction effect for our healthcare costs everywhere. Now, what's probably going to happen is the pharmaceutical companies are going to, their margin's going to come down, and their stocks all drop today significantly. But what they'll probably do is take that $100 in the other country, bring it up to $200, take our $500, bring it down to $200. They'll find something in between. So it won't be, we're going to drop to $100, and that's the 50 to 80% reduction people are talking about. The pharmaceutical companies are probably going to have to find some middle ground. Of course, they're going to fight with the other countries to find that. and that's going to be our price. But the most important piece is we are now going to have the lowest price anywhere in the United States among developed countries, which is seismic for you in terms of your out-of-pocket, in terms of your health plan out-of-pocket, whether you work for a company, you get it through Cover California, you have it through Medicare and Advantage Plan, Part D, it doesn't matter. It's going to bring down the cost across the board. Huge. The second piece is around it's around PBMs, but it's called direct to consumer. What that means is it's going to say, hey, if they don't bring down the cost, we're going to give options for consumers to buy direct from the manufacturers. That brings up a whole nother piece we need to talk about, which is this middle person called the PBM. And that's another key piece that most people don't realize, but you're paying for it with every medication you buy. Let's look at that now. All right, we're going to show you a little bit about how the sausage is made. And you may be like, well, I don't want to know that much about how medications are paid for and pushed through, but you're paying for it. And this is important, and it's fascinating. So after the ACA law in 2010, which started in 2014, basically Cover California created the exchanges, there was a margin cap they put on insurance carriers. They said you can't make more than this amount, which is good. It kind of keeps everyone equal and even, and make sure they don't spend too much essentially on overhead, everything else they have. What happened is it created this explosion in this thing called a PBM, which is basically a middle person for prescriptions. So in theory, they were going to bring costs down by consolidating purchasing, really. Well, the carriers are very smart, and they realize that we're going to buy these PBMs, and there's no margin requirement on those. So the carrier buys the medication from the PBM, which they partially own. The three biggest ones are owned by three giant health insurance carriers. And the next two or three are also owned by health insurance carriers. We won't get into who, but there's this kind of interwoven connections or relationship between them. There's no margin requirement on those middle people. And then the middle person then sells to the pharmacy, CVS or whatever. In fact, some of the biggest carriers have integrated all of this together. It's a way to make a lot more money on your prescription purchases. And this law basically is going to crush that whole model, because it's saying if you can't get the pricing down, then the consumer should be able to buy from another country, or they should be able to buy directly from the manufacturer. That is fascinating, because this was a huge chunk of profit to the carriers, essentially, and yet cost to you that you were paying for. And it exploded after the ACA, the Affordable Care Act, went into effect. This law is going to crush that, because it's going to say if you can't deliver the lower price, then the consumer can buy direct from the manufacturer. All right, those are the two big pieces. It means a lot lower cost to you. Let's take some examples and see what that really means. And then after that, stick with us, because we're going to talk about timing. Because if this is 5 or 10 years out, who cares? But that's not the case with this order. It has teeth. And let's take a look at that after we look at actual costs. Hey, before we jump into how much you can save with actual examples, please like and subscribe below. We're going to continue to bring up-to-date information. This executive order just came out last night. As we get updates that directly affect how much you can save, we're going to bring it to our subscribers right away. So please like, subscribe, and we can continue to get this info out to you. Let's get into real examples of savings now. Let's look at real examples. But first, understand, in California, we spend about $500 billion on healthcare, and roughly a quarter of that is medication costs. Let's say $100 billion. It's a lot of money. And whether you have Medicare or a private carrier or Cover California or Medi-Cal, we're all paying for it in form of premium, taxes, you name it. Also, keep in mind that 25% of Californians are struggling with their cost of medication. And the average out-of-pocket is around $1,500 for Californians in terms of their medication. And that's taking into account Medi-Cal, where they're paying nothing for theirs. on most cases. So it's a lot of money we're talking about. Speaking of a lot of money, let's look at actual examples for 5 of the biggest and most expensive medications out there. So we're going to start with Ozempic, which is a massive, very popular drug for weight loss and diabetes. Really, weight loss takes the popularity to where it's at right now. Ozempic currently is running around $1,000 price to you. However, the most favored nation is roughly half that, $4.99. So we can expect that cost to drop maybe in half, maybe a little bit less, but that's a lot of money that people are going to be saving now. Next up, we have Humira. This one really stands out. This is an autoimmune drug. Look at that, $6,000. We're paying for it here in California. The most favored nation price, $2,000. That's $4,000 difference, roughly $50,000 plus savings per year per person that's on that. And think of how many millions of people across the U.S. are on Humira. We go right down. You're starting to see these other medications pop up a lot right now. Eliquis, $500 a month. We pay $150, most favored nation. Boom, that drops $350. Jardiance, another big one. Real interesting class for diabetes. And literally, you excrete sugar out of the kidney. Fantastic drug. My mom's on it. $550 we're paying. My parents don't want to pay that. It's a lot out of their pocket. Boom, $200. It comes down. That's a third of what we're paying that they're getting right now in other countries, and we're subsidizing it. Finally, Xarelto, another very popular one. Again, $550 down to $175, saving under $5,000 a year. If you look at the savings, it's $5,000 per person on average for these brand medications that we're paying, that we're going to save. The whole system's going to save. This alone may save Medicare. It may save Medi-Cal or Medicaid, because all of a sudden we're going to bring these costs down. And if not, then there are all these parts in the executive order that's going to allow us to get medications cheaper. That's all great. Is this something 10 years out, 5 years out? No, it is fast. Let's turn to the timing of this executive order now. Usually when we hear these grand kind of offerings from the government, it's years out, right? It's a promise in the future, but keep paying now. This executive order turns that on its head, and that's why we're so surprised by it. The pharmaceutical companies have 30 days, essentially, to bring our costs down to the most favored nation costs in other countries. 30 days. If they don't do it within 30 days, then there are mechanisms in the law to force it, to allow us to buy from other countries. Everyone's been screaming about, oh, we wouldn't want to be able to get our medications from Canada. This executive order actually allows that in 30 days. When you know the pharmaceutical companies are going to try to adjust this as quickly as possible because they don't want that. But either way, it's an equal playing field now. You can't have a more expensive drug in Japan or Canada or Mexico or Europe. It's all one number, and we're going to get that number. And if they don't do it in 30 days, the law has all these different ways of forcing that issue or allowing us flexibility to get the medication in a different way. We're super excited. Let us know down below how much you're spending for your medications per month. You don't have to tell us the medications, but what your out-of-pocket is. And then we'll kind of see how crazy these numbers are and how big an effect this can have on people's pocketbooks and on small companies that are offering employer coverage. It can bring down the cost everywhere. This is fantastic news. Let us know what you think down below. If you stuck around this long, thank you. We appreciate it. You probably have more questions. Reach out to us. There's zero cost for assistance. You can call, email, chat, or best yet, book a time, and we can go through your personal situation to address any questions regarding California health insurance. Because a lot of sources out there are nationwide, and California is really unique. We need to go through the specifics of your situation in your area to find the best options. We don't push. We don't try to sell anything. We answer questions. And if you look at our Google reviews, you'll see that reflected in how we deal with this. We're happy to help. Reach out to us. And do us a big favor. If you could like and subscribe below, that's fantastic so we can keep bringing this information to California.